All right, joining me right now to talk more about this hantavirus outbreak is Dr. Amish Adalja. He is a senior scholar at Johns Hopkins University Center for Health Security. Doctor, great to see you.
Thanks for having me.
So what do you think about these plans to bring the American passengers to a quarantine facility in Nebraska where they would be assessed and then undergo potentially home-based monitoring?
I think that's the right way to do it. What you want to make sure is that nobody develops symptoms in transit. And if they do develop symptoms, that they can be rapidly tested and linked to care at a place that's highly competent. Remember, Nebraska is where many of the Ebola patients in the 2013-2014 West Africa outbreak were taken care of. So this is an expert unit at Nebraska. And then I think if people are deemed to be low risk and you can link them to local public health and teach them about home monitoring, I think that's a reasonable way to do it. So I think this is exactly by the book or how I would recommend it be done.
So home monitoring is going to take a lot of discipline, right, for any of those individuals. So I'm wondering, what kind of risk overall does this virus or even those those people potentially pose to the general public?
Very little. Remember, this is a virus that is very constrained in its ability to spread from person to person. It's not like COVID or influenza, and certainly not like measles or even Ebola for that matter. And remember, back in 2014, we had many healthcare workers returning from West Africa that were being monitored in a similar manner at their houses, and that was a higher consequence disease and much more high intensity with Ebola. So this is something that local public health has dealt with before, and I think can do. There's 17 or 18 patients that they're going to be doing that to. It's not as big of a task as it was with Ebola.
So what is it about this strain of the hantavirus that makes this one so much more deadly or dangerous?
It's not more deadly. It is more dangerous in the sense that it's able to spread from person to person. Usually hantaviruses are all rodent to human and then basically dead end. It doesn't go anywhere else. The Andes version probably has more virus in your blood, in your secretions, so it's able to spread from person to person in limited circumstances, and there have been outbreaks. So that's what's kind of raised the stakes for this outbreak, because it is the version, the one that's dominant in Argentina, is the Andes variant, and that variant is the one that spreads from person to person, and we've already seen person-to-person spread occur on that ship. That's obviously a special consideration on a ship, but that's why there is this monitoring. That's why there is this quarantine station being involved.
All right, we'll leave it there for now. Dr. Amish Adalja, thank you so much for your expertise. Appreciate it.
Thanks for having me.